Scrotal pain is not an uncommon malady that affects males across all ages. In the vast majority, it is not serious, but nevertheless affects the quality of life. In the remainder, it can denote a serious condition. To understand scrotal pain, one must have a basic idea of the human body part called scrotum. The scrotum is a sac-like structure in males which houses the testicle. In addition, it also contains another cap of tissue which is opposed to the top of the testicle in its lower part, which is called the epididymis. While the testis produces sperms and the male hormone called testosterone, the epididymis stores the sperms where they mature and then are transported in the semen during sexual intercourse. The epididymis is in fact a single, very highly coiled long tube which continues onwards into the body as the vas deferens. It is this structure that is tied during vasectomy operations. This fine tube joins the urine passage in the region of the prostate. Both testicles are formed inside the belly or the abdomen and come into the scrotum at birth. It is therefore imperative that when a male child is born, one must make sure that both testicles are in the scrotum. If not, appropriate consultation should be sought before the child is 6 months of age. As the testicle comes into the scrotum at birth, it brings with it its blood supply, which is vital for its growth. Scrotal pain can therefore be caused if any of these structures are affected. In the prepubertal and adolescent male, one of the serious conditions that cause scrotal pain is called torsion. This is as a result of the blood pipes twisting on itself. This gives rise to severe pain. The condition is often missed and not treated as an emergency. The testicle can be irreversibly destroyed. Subsequently, it could also affect the other side. Another condition affecting the scrotum is called varicocele, which simply put is like varicose veins of the blood pipes that take the impure blood from the testis back to the heart. This can be an incidental finding, giving rise to nose problems in some men. It can also cause a dragging pain in the scrotum, which will require surgery. Importantly, in some married men, it could be the reason for not being able to father a child. Cancerous growth in the testis is usually perceived by the patient as a heaviness or an obvious increase in the size of the testicle. Most patients notice this while bathing. Unfortunately, the swellings are relatively painless. Failure of the testis to enter the scrotum at birth is a harbinger of cancer. Urinary tract infection is yet another cause of severe scrotal pain accompanied with fever and swelling. This condition affects the epididymis due to its connection to the urinary tract. Yet another common cause of scrotal swelling which causes pain or heaviness is called hydrocele. This is simply just a collection of fluid around the testicle. Whilst these conditions which are listed are more important causes, one condition that is very distressing to men is called orcalgia. Simply put, it means pain in the testis. This is a condition which is a diagnosis of exclusion and for which no obvious cause is apparent. But nevertheless, factors like stress, anxiety are paramount in its causation. Many of these patients will require counseling as psychiatric evaluation for depression and other such illnesses. In conclusion, it is imperative that an ultrasound of the scrotum is done in any male with scrotal pain.